I am Dr. S.K. Pal. Today I am here to introduce Innovis PCNL learning model. This model gives you a real feeling as to what situation you are going to face in operation theatre. This model is showing the patient lying in prone position. This model has been nicely fixed with the help of straps on your operation theatre table. This is the C-arm which has been positioned at present in 0 degrees, but when we initiate it will be in 30-degree position. We will show you how. This model exactly replicates that situation when you are in operation theatre and you are going to start your PCNL and going to make a initial puncture. The instrument which we use, this is a 3-part initial puncture needle, and I will recommend for all the beginners to use this Innovis 3-part initial puncture needle in the beginning, because many of your punctures in the beginning will be unnecessary and fruitless. So all those punctures in the kidney should be with the thin part of the needle. But through this thin part, you cannot pass the guide wire. Once you get saline, once you get urine after successful puncture, then the outer part is slided slowly over this and inner part is removed, and through this you can pass the guide wire. So this is the thick puncture, which is the only one puncture when you obtain the urine after making a track. So this is needle which I am going to use. Apart from that, you have to have just some saline, because this model does not require contrast agent. Just with the help of saline you can do the job. And one 2 cc needle, one 5 cc and 10 cc needles. This is all is required. And now we come back to the machine. This is our C-arm. This is the model, and when you press the foot switch you get this particular picture as you are seeing on the screen. Now we will be positioning this C-arm in 30-degree tilt position. You can see the C-arm has been tilted 30 degree. I will show you once again. This is the image when the C-arm is in 0 degree. If I put the foot switch on and take it, this is how your C-arm with 30-degree tilt, the image intensifier should hit your head and X-ray tube should go away from your genital. Now you have to inject saline from here. This is simulating the ureter. So you take out this lock from here, take this saline, and when you are injecting the saline, see what happens in this C-arm. You can see some movement, and this has gone into the kidney. Now I will hold this needle and position it on the back of the patient. This is my target, and I will not enter this target in this way, neither on that way. I will position the needle in alignment with the calyx like this, and this is my target from where I have to make entry if I choose the inferior calyx. Now I will take my finger about 4 centimeter away on the model. This should be my puncture point. From here I will push the needle inside, and this gives me a feeling like you are going through the human body. After making the puncture, now you see the angle of my entry. If you see this angle, this is somewhere around 30 to 40 degrees. With this angle in a thick patient of 12 inches thickness like this is the angle through which you should enter the human body. Now all my progress after making the skin puncture will be under vision, under image intensifier vision. My needle is advancing inside. You can see that. Now the angle of entry is somewhere around 35 to 40 degrees. I am advancing towards that, and now when this is going in a corner of the calyx, I will not accept that. Take out the needle, Again, I will make the angle little different, the skin puncture different. Now I am heading towards the center, going in. Now I am heading in the center. You can see in 30° I have entered the calyx. Now I will check whether I am in or out. So in same I will position, change the C-arm from 30 to 0. And you can see that the needle has tilted, has shifted little laterally. That shows me that my needle is superficial. I will have to increase the angle. So again, I will position the C-arm in 30°, take out the needle and increase my angle. Can you see me increasing the angle from the skin? Now I have increased the angle little bit. Again I am in 30° and going towards the same, made a puncture. Now turning from 30 to 0, and you see the needle is in the same place where it was in 30°. So I am sure I should be inside. I will take out this, put the saline from below. This is the saline, this is the ureter, injecting the saline from here, and you can see the saline has started coming out through the needle. So this is the successful puncture. If my needle was not in, I will come to know by the simple maneuver. If I don't get the water, in which situation I won't get the water? If my needle is not at this angle, if my needle goes at a lesser angle like this, you see, now I have reduced the angle. Can you appreciate that? Now I have progressed, but the angle is less, although it will appear in 30° that I have entered. But as soon as I turn it from 30 to 0, watch my needle, the needle tip will move lateral because I am posterior to the needle. See, the needle is moving lateral. So in this case, when I inject saline, there won't be water coming out because I am backside of the kidney, I am not in the kidney. When I inject, I don't get water. So I am not in. Now, if it is an unsuccessful puncture, you can come out up to the skin, and then either you can decrease the angle or you can increase the angle of entry depending upon how the needle tip was moving when you shifted from 30 to 0°. If the needle tip was moving medial to the target, you were deep, so you have to reduce the angle. If your needle tip was moving lateral to the target, when you turn from 30 to 0, your needle was superficial, and next time you have to increase your angle. So like this is the angle of entry which you have to learn on the model. Another situation may arise when your needle is too deep. Let us see that situation also. If my angle of entry was not accurate and position 30°, now I am increasing the angle. You see, my angle of entry has become almost 70°. I am heading towards the target. I am heading towards the target. In 30° view, it looks as if I am inside. And as soon as I turn from 30 to 0, the needle will move medial because it is too deep. You see, the needle is going medially. It means I am deep. I am deeper to the target. Again, inject the saline, nothing will come out. So I am not in. This is the way you will learn the puncture, by exactly knowing what angle is required to enter the kidney. I will show you an accurate puncture now once again. Now we have learned that the angle of entry in this particular model was around 35 to 40 degrees. Now again I have positioned same way, going in 35 to 40 degrees, going in, going in, going in, just entered inside the system, although a little lateral, but it's okay, it is in the pelvic ileal system. When I turn from 30 to 0, my needle still remains inside only. So I hope I will get this saline when I inject from below. So once you inject the saline, it starts coming out. Now you know, in particularly this patient with so much of thickness, the kidney is at this depth. By this model, you can very well learn what angle the patient will require, and by 30 and 0 you know the positioning and the movement of the needle, and you should be very thorough in on the model, so that when you really reach in the operation theater on human being, you will be thorough with the movement of your needle, coordination between your hand and the C-arm, your foot switch, everything you will practice in the cool surrounding of operation theater, and later on you can do the same on the human beings very comfortably. So this is how you learn PCNL on this model and be successful in making a confident puncture every time. Thank you very much.